So a lot of patients have been asking me what exactly is the shingles vaccine, who should take it, and how does it benefit. So any of the individuals who are above 50 years of age, so if you or your partner have crossed 50 years of age, your immunity starts to come down. So when there is a viral fever season going on as now, then there are high chances that you may get this viral infection, which is called as shingles or herpes zoster, which usually presents with red colored blisters over a dermatome, means one side of the body, like on the thigh, along one rectangular pattern. So these lesions usually start as small blisters. They can increase in number, or the pain or the severity, as if the pain is coming from deeper tissues like from the bone or muscle, is what you would generally feel. Whereas the lesion is just present in the skin itself and not in any other body part. So this is one area where you have to take preventative vaccination. Just the way we give children vaccines for chickenpox, we also give elderly vaccine for shingles, which is a same form of chickenpox where the virus has remained dormant in your ganglions. So it gets triggered every time you fall sick, when there is a fever episode, when there is disturbed sleep or some kind of stress that you're going through, or if you're already immunocompromised with conditions like diabetes, you're on medication for hypercholesterolemia and many other conditions which most people contract after a certain age. So it's important that you reach out to a dermatologist to get this vaccine. Usually this vaccine contains of 2 doses which are 2 months apart. If you have already gotten this problem, then you should not be taking this vaccine for 3 to 6 months after the rashes have come down. However, your partner can take it, like your husband or wife can take the vaccination to avoid same symptoms or same problem in the near future. When you get this infection, you're infectious. You can transmit the infection to younger children or pregnant women, so you have to remain in isolation because the particles of the virus can transmit either through contact or through aerosol, or that is through air, or it can also come by using the same restrooms or using the same beds, sofas, etc. So it is important that you vaccinate other elderly people who live along with you or work along with you, so that all of you are having this community resistance for this problem. And this problem, essentially, why do we have to take vaccination, is it's an extremely painful condition. It is not painful just when you have this infection, but for many months after that, which is what we call as post-herpetic neuralgia. Most of the time this condition goes undiagnosed or is diagnosed wrongly by other doctors, as they do not understand the skin symptoms of shingles immediately. Or if you end up going to a pharmacy and taking a cream, you may get something like a corticosteroid, which is highly dangerous if you apply on the infected area. So the symptoms which will help you recognize that you're having shingles is extreme burning sensation, pain which is radiating to the areas above and below the lesions, mild redness that it could trigger, some kind of pain especially in the area even before the lesions get triggered. All these are the symptoms which will help you diagnose by yourself that you're getting shingles. You can get it tested by a doctor, especially like a dermatologist. Sometimes most physicians also are aware of symptoms of shingles, so you can reach out to a clinic nearby. And the vaccination is usually, it protects us against these kind of symptoms for several years after the vaccination has been done. If you have already got chickenpox, will you get shingles? Yes, of course, the patients who have already got chickenpox only are subjected to shingles most of the time. Mostly these days, children are receiving chickenpox vaccination, so they can have subclinical infections where some people may get shingles even without getting chickenpox as well, because the clinical symptoms are not existent. So in these kind of cases, reach out to a dermatology clinic, get a shingles vaccine done, repeat the vaccine after 2 months, especially if you're immunocompromised. Immunocompromised can mean if you're having other conditions like HIV and other immunocompromised genetic conditions, you can take this vaccine even if you're 19 years and above. We generally recommend this to adults and not to children. And if you have any more queries, you can drop it in the comment section below.